The first program that we began in the summer of 2016 was a simple, a naive, but a beautiful idea, and it was our medical ESL program. The Literacy Council does an exceptional job here in Lancaster of helping people to begin to learn a language or to improve English. We started with just 2 or 4 doctors, and they were all from Cuba. We now have physicians or healthcare professionals from other countries: Ethiopia, Poland, Germany, Brazil, Democratic Republic of Congo, and I could go on. To have us together in a room talking medicine, even though we may be struggling in English, we're not struggling in the other language that the doctors all speak or the nurses all speak, and that's medicine.
Just say hydrochlorothiazide.
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 Now just say hydrochlorothiazide.
Hydrochlorothiazide.
You got it.
When we sing, it makes it so much easier to be able to speak more clearly.
There's a lot of work behind this. There's a lot of volunteers who are helping us in a very good way. They are not only helping us with the English, and they are taking care of us as a family, a very big welcome.
It's not only us here, it's our family involved too in that program. So have a tutor who working with us online. When we participate together, for example, in my case with my son.
When we started that program, every one of the doctors came in with their head down, and they would whisper, and they would say, "I was a doctor in Cuba, and now I'm in a factory."
I came and I started working in a factory to be able to pay bills and do something with my life. And this program, it was a huge change. Right now I'm running for a bachelor degree in Penn State College, which is something unbelievable. I'm still dreaming with that. Sometimes I say, is this real?
Within 3 or 4 sessions, when somebody new came to join us, that person would walk in, we'd do the introductions, that person would say, "Hi, I was a doctor in Cuba." And all the other members of the class would turn around and say, "You still are a doctor." In order for us to excel in this program, we branched out even further. The relationship that we have with Hershey Medical Center's simulation lab permits the doctors to be studying and to be reviewing basic areas of medicine, to get advanced life support certification, and to be able to feel comfortable in a clinical scenario again. The Penn State University Dickinson School of Law is phenomenal. Dr. McLoof is an immigration law specialist, and she's working with us now that our doctors are getting ready to apply for citizenship. There are only 5,000 nationally certified Spanish-English medical interpreters in the United States. 10 of the doctors and 2 of us have now completed a 100-hour course. To be able to go to a hospital and to be a trained medical interpreter, our international healthcare professionals will once again be on the front lines of medicine.
We can also pay back to the community working here in Lancaster with the Spanish population have been growing up a lot, and now we are able to interpret for them.
We could not have done that without the Pennsylvania Medical Society grant. It helped pay for the tuition.
In the meantime, do you know that phrase? In the meantime?
Mm-hmm. Yeah.
While everything else is going on, in the meantime.
The Literacy Council, with the help of the Pennsylvania Medical Society's new grant, we now have a 3-hour class once a week that is going back to the basics of English structure, keeping in mind that Brittany is teaching healthcare professionals from other countries. We now have a program within Lancaster Health where our physicians, who are Spanish and now new English speakers, are teaching a medical Spanish class for their nurses and doctors in the evenings. In order to learn a new language, it really helps to believe in yourself again. So what the doctors told me is that this class, which looked like a medical ESL class, was food for the soul. They want to live as best they can the American dream, and they're just so ready to give back to their community.